Everyone, Scott Nicholson of the Judy Nicholson Kidney Cancer Foundation coming to you live from the Premier Physical Therapy office in Jacksonville. I'm here with Chris Kopp. He's going to answer your questions today about how physical therapy can help cancer patients and cancer survivors heal. So we'd love to have your questions, and we look forward to answering any questions that you have. So without further ado, here's Chris Kopp.
All right,
Thank
thanks
you very much.
Thanks, Scott. Appreciate it. So, man, my pleasure to really be here on this Facebook Live event for the Judy Nicholson Cancer Foundation, Kidney Cancer. You know, I was asked a couple months ago from a patient if I would want to get involved, and they were supposing they had a UNF and talk a little bit about what I do with cancer patients or how physical therapy can help. And that was just, you know, it's amazing to go there and listen to the stories of everyone who has to go through the suffering and the trials and tribulations of cancer and all the treatments and everything and all the things that are coming up that are helping those patients. Physical therapy being one of those, at least in my opinion, and I think the medical community supports it as well. So this is a great little forum, and I'm just honored to be able to be here. And it's Premier Physical Therapy. Been practicing about 20 years. I graduated from UNF, so I've been in Jacksonville for 23 years. I live in Atlantic Beach, and I just love living here. I love being a part of the community and doing all kinds of activities. Our clinic specializes in orthopedics, and with cancer surgeries, particularly breast cancer, is how this all got started. Women had limitations in shoulder range of motion, and then that just kind of led me down the road of, wow, they're not really being serviced real well after their surgeries. And then within my professional association, we have an oncology subsection. So I joined that. So cancer rehab, we have a journal called Oncology Rehabilitation that I received. So it is actually a part of physical therapy. It's a part of our physical therapy association. We actually have a board certification coming up here soon that just got approved for oncology rehab. So I'm excited to have this as part of my practice in addition to the things that we do, treating the neck and the back pains and the knees and the foots and ankles. But people who are sick and I can help them feel better is just as rewarding, if not more so, than helping people with pain. So there we go. That's the gist of what we're doing today. And hopefully you'll learn a little bit about some questions about cancer and exercise and physical activity, both if you're ongoing treatment or a survivor, or hopefully prevention as well. So let's see if we got any questions going on here, Scott. So I'm just peeking up and walking back and forth.
Yeah, we do. The first question that we have here is, are cancer survivors active?
Okay, so the question is, not sure if you can hear that, are cancer survivors active? The research says no, unfortunately. And lots of reasons for that. Obviously, I've never had cancer or had to go cancer treatments, so it's easy for me to say, come on, get off your butt and let's go and start doing some things. But the truth of the matter is the research is not very good regarding to physical activity and exercise for cancer patients. Lots of reasons for that. Fear would be a big one, right? So they're scared, okay? I'm not sure if I'm allowed to do that. That's what happened with the breast cancer and the shoulder stuff that I got. A person came with limitations in shoulder range of motion, and I said, oh, well, why aren't you doing something about this? Well, I was told I shouldn't exercise because I might get lymphedema in my arm, and that's actually not true. You exercise your arm to prevent lymphedema. Now, obviously, within moderation, like everything else. We also have malaise, which is just feeling like crap, not feeling good. You know, I don't really feel like exercising. I don't have the energy. Well, we do know that exercise produces energy. So that's how you would combat that. And then obviously you're not sure if it's the right thing for you to do from a health status. Is this going to affect my treatments? Is this going to do something to my cancer area? Is it going to make my cancer spread? And the research is no, that's not going to make your cancer spread. So there are some precautions which we could get into at some point in time. But no, the research is unfortunately cancer survivors are not active, and they tend to get unhealthy if they weren't healthy to begin with, they become unhealthy, and that actually leads to more risk factors for more disease. So.
And is there any difference between exercise and physical activity?
Great question. Any difference between physical activity and exercise? Physical activity is exercise, and it's really about moderation. So whether you're in a nursing home setting and you're doing chair exercises, or you're gardening, or maybe it's just walking around the grocery store, you know, any action is better than non-action. And then obviously it's related to intensity. So when we talk about physical activity and exercise, you have three variables, but two real main variables. And one is intensity, okay? Intensity, how hard am I working? How hard is the activity? And then duration. How long do I do it for? So you can have high intensity and low duration, which is kind of what we usually look for, or low intensity, longer duration. They're kind of reciprocally relationships, okay? So we can sprint for short distances and have to take lots of rest breaks, or we can jog really slow or walk long distances and maybe do that for a longer period of time. So, and again, we kind of let fatigue dictate that a little bit as far as how hard we're working. Depending on what questions come up, I can finish up with some summation about some more specifics regarding physical activity and exercise. They are interrelated, but they're usually exercises really for a specific purpose, where physical activity is just doing things to be active.
That makes sense. What does exercise have to do with people with active cancer or those in remission?
Okay, so to carry over with the previous question, is exercise and physical activity, are they different? No, they're not different. So the problem that we're finding is that with patients who are undergoing cancer, they're just not active. So they're not exercising. We measure exercise, or kind of our exercise capacity for that matter, is really a kind of a technical term, and that's really called VO2 max. And that's really our oxygen consumption related to our intensity levels. And there's been some research that shows that, and this goes along with inactivity, that with this being VO2 over here, this being bed rest, that there's a downward slope like that. So as bed rest goes up, VO2 goes down. So if you're in a hospital situation, for instance, that's why therapists are coming to your hospital room and asking you to get up and start walking and moving around. And the benefit of that then is when you get out of the hospital, hopefully you'll have a little more energy. And there's also good research that shows that with being a little bit more physically fit, or having a better VO2 max specifically, that you have a better tolerance to the side effects of cancer treatments. So chemotherapy-related fatigue, for instance. Self-esteem, body image. Oh, how about endorphins? What are endorphins? There are naturally feel-good hormones that get released with exercise and activity. And then we have cortisol, which is stress, which is kind of tears things down. So endorphins kind of counteract cortisol. That's why we always feel a little more energized after we exercise. I ran with my daughter yesterday morning, and I'm not usually a morning person, and I actually had more energy even with a little 20-minute run. I'm sore today, so my intensity level was obviously at the right level, even though my duration wasn't very long. But I came home from that run, and I posted it on Facebook. Somebody may have saw that. The sunrise was beautiful. But I actually felt more awake and felt a little better and happier after I just ran to the beach and back and saw a nice sunrise with my daughter. So maybe there's a lot of things in there. So lots of good reasons to be physically active and exercise under why you're going active cancer treatments. Again, there are some precautions and things that you need to be kind of aware of. But generally speaking, it attacks the side effects and makes you feel better just in general, obviously within your tolerance levels.
And you had mentioned intensity. How do you measure exercise intensity, and how do you know if you're working hard enough?
Right. So we call that, that's called RPE. RPE. And basically it means rate of perceived exertion. And there are some scales out there. If anybody's gone through cardiac rehab or something like that, we have these rated perceived exertion scales. And for some reason it starts at 6 and finishes at 20. But if you want to think about it on a 15-point scale, and a 6 out of the 20 is really no exertion. I'm laying in bed. I'm not doing anything at all. And then as you go up the scale, let's say 9 out of 10, that's very light, somewhat hard, very hard, extremely hard, maximum exertion. This is when you're almost getting anaerobic, where you can't have a conversation because you're breathing so hard. So generally speaking, for most people who maybe only have a couple health issues, we like them to feel like the activity is somewhat hard, light to somewhat hard. You're not out of breath, but you feel like, wow, I feel like I'm working a little bit. When you become like you can't have a conversation with somebody, as a little test, can you count to 10 with one breath or something like that? There's a couple different things we do. We use pulse oximeters too, which just measures your heart rate. However, some people are on drugs that control their heart rate, so you can't always use heart rate as an indicator of how hard you're working. It's really about how hard you feel like you're working, and the idea is for you to make it feel like you are doing something somewhat a little bit difficult, but not extremely difficult, and obviously not like I can do this for a long time. Okay, good questions.
She says, next question Lauren asks is, what kind of improvements can a cancer patient or survivor expect?
Man, so many to mention. From a physical standpoint, if you want to look at it from an exercise physiology means, a cancer survivor can expect to have the same gains and same physical changes that a non-cancer survivor or a non-cancer person can expect to get with exercise training. Obviously, it depends where you're starting from, what your baseline's at. So, but specifically, you're going to have an increase in your immune system for a cancer patient. You're going to have an increase in your physiological reserves. And that means is that when all of a sudden you need to be active for some reason, you have some reserves to call on to help you with that. So if you can be consistent with an exercise or activity routine, and all of a sudden someone says, hey, do you want to go out to the mall? Or do you want to go walk around somewhere? Or do you want to go out? Do you want to do this? Oh my God, I don't know if I'll have the energy for that. So by giving you some reserves, you're going to have energy to do some activities and get out socially. Again, it helps with the immune system. It helps with fatigue and all the other physiological changes that normally would happen when you start to exercise. Obesity, we can talk about that. Big tag of obesity to risk factors to recurrence, or actually obesity to even specific cancers. So what we generally find is that cancer survivors typically become unhealthy, and that potentially could lead to some other diseases.
And so does research support that exercise with patients does research support exercise with patients with, does research support exercise with patients with or have had cancer?
Yes. So does research support the use of exercise in cancer? Absolutely it does. Multiple studies. You can certainly email me if you want those links to some of those studies. But
what's your email address?
So it's chris.kopp@pptjax.com. You can go to Premier Physical Therapy. You can find me there. You can probably just Google Chris Kopp, Physical Therapist, Jacksonville, and I'm sure you find me. But it's really chris.kopp. I will post it up here in a second. But chris.kopp@premierphysicaltherapyjax.com, pptjax.com. And on premierptjax.com, physicaltherapyjax.com.
Perfect.
pptjax.com. Lots of different ways to find me online. Back to the question was,
does research support it?
Yes, it does. We have lots of studies that measure this VO2 max that I mentioned earlier in palliative care units, in active situations, and then obviously and cancer survivors. So there are lots of studies out there on that. You can just do a PubMed research, exercise and cancer, and you'll see lots of hits on that.
So Dawn is asking, is exercise safe for cancer patients or survivors?
Is exercise safe? Exercise is safe for cancer survivors just as much as it's safe for anybody else based on their risk factors. So there's no real, direct thing, but there are a few things that you need to be aware of if you have gone through cancer treatment. One is hormonal therapy. So if you've had hormonal therapy with your treatment, and those who have know what that means. You have bone fracture risks, okay? So you have to be a little careful with impact type activities. So swimming would be a little bit safer. At our clinic, we have the Ultra G anti-gravity treadmill. That's one of the reasons why we had it. So you have to worry about some bone fracture risk, osteoporosis, things along those lines. Some of the other things that you need to consider, it would be more along the lines of general health risk factors. If you're somebody who has cancer but has heart disease, well, obviously we need to pay attention to that. If you're somebody who has cancer and has some pulmonary issues, obviously lung cancer, then we have to worry about, how you're doing with your pulmonary function. So the truth of the matter is, it's just like any other person. We look at the risk factors and what we need to be careful of and what we not need to be careful of. But it is important really to get with a physician, and I highly recommend a physical therapist who understands exercise physiology for people who have health issues. Not to say that a personal trainer can't do it. It's just that, we understand that there's normal physiology and normal healthy people, and then we have people that aren't healthy, and we need to be a little more paying attention to them. I would also say the other risk factor with people for exercise is falls. Typically, our cancer patients are a little older. And so as you get older, you end up having some balance issues. You might even have chemotherapy-induced peripheral neuropathy. Those of you who don't know what that is, good. Those who do, I'm sorry. It's not very fun, but obviously it's going to affect your balance. Then you're a risk factor for falling, and now you may be a risk factor for fractures. So not so good. Okay, so just the synopsis of that is it's really no different than any other population, just taking the risk factors of that person's health history is about.
Awesome. And can cancer survivors expect to achieve similar results with exercise and activity as non-cancer individuals?
Yes. So again, the way our body responds to the stimulus that we give it, it's really no different than anybody else. In fact, research has shown that you can get the same benefits of weight training all the way up till they throw dirt on you, for lack of a better word. All the way up till elderly life. Now, we do have to understand, I'm 48 years old now, and my recovery time is not like it used to be, and I have to probably take things a little bit more in moderation because I have a 48-year-old body. So I have some arthritis in my knees from being an athlete as I was younger. I don't have any other risk factors. But yes, the same physiological changes, improved body mass index, improved heart rate, cardiac output, strength, flexibility, endurance, all those things, all those physiological systems are in our body that are going to respond to those stimuluses.
And who should a cancer patient or survivor consult if they want to be physically active or start an exercise program?
So obviously we like a team approach. So it's nice to have, if you're still undergoing chemotherapy, that's important to be working with your oncologist because we have some things that are affected by chemotherapy. We have anemia, there's some blood platelet stuff going on. So there are some things that we want to know where your blood level values are. And so that would kind of dictate, hey, you should be careful about, falls because you might have a bleed out, or we may have to worry about waiting for your iron to get up to a certain level and things along those lines. So first and foremost, your oncologist, if you're undergoing chemotherapy. If you're not, then your family doctor should be able to run those blood works for you. And then we obviously recommend, a physical therapist, predominantly who has worked with cancer patients or at least has a little bit of a background and understanding how to exercise those who have maybe some complicated health issues. And then at that point, it's just a matter of giving you some guidelines and some structure and saying, these are where your parameters are, and these are the signs and symptoms of some things that aren't going the way we expect, and how to modify that, and then how you can self-progress based on your tolerance level and how well you feel like you're working.
Awesome. Catherine asks, what can we do to repair and nourish atrophied muscle?
Okay. So use it or lose it. Unfortunately, we atrophy really fast within just 24 to 48 hours. Any of you that I've been in the hospital, but not in a long time. But obviously, any of you that know who've been hospitalized, you know how quickly muscles atrophy, and it's just a matter of slowly adding some resistance to these muscles, and they build up slowly over time. Unfortunately, a lot longer than they go away. It takes longer for them to build up than it did to take them to go away. Have you ever been in a cast? I had my arm in a whole cast, for 6 weeks, and I came out and there was no muscle on my arm whatsoever. and it took a little while to get that thing going again. So it's the same thing as for anything else. Obviously, the longer you've been active, the longer you haven't done things, the more atrophy you have, the longer it is to get that back, which is why we encourage activity in the hospital during hospitalization stays to prevent atrophy from happening.
What types of physical therapy are best for cancer survivors?
So that is more on the lines of the specific toward your cancer. So if it's breast cancer with or without lymphedema, so okay, what exactly do we need to address? So breast cancer, maybe you've had a mastectomy, you've had some radiation, so you had some limited range of motion. Head, neck, and facial cancer, same thing. You maybe have some scar tissue. There could be some swallowing situations going on. So then there's a speech therapist getting involved. So it's really based on the examination. Where was your cancer? Did you have to have surgery for it? Did you have lymph nodes removed?
Is there anything, is there any special type of therapy for patients that had kidney cancer?
So not necessarily. You know, with our kidney cancer patients, obviously we have, again, it depends whether, I know they've been doing some surgeries and things on the kidneys. And so, again, it goes back to, did you have surgery? What's your kidney function like? You know, we want to pay attention to swelling. You know, how well you're processing intake of fluids and those kind of things. And obviously swelling starts to back up, then that puts a demand on the cardiovascular system. So, you know, to be honest with you, specifically for kidney cancer, that's what I would be thinking of as renal function, kidney function, and then metastasis areas that I might need to know about or be worried about.
Great. Well, that brings us to the end of our 20 minutes. But
Wow.
if you guys, if they have any other questions, how can they get a hold of you?
So again, you know, I'd love to help anybody out. I mean, that's why we're doing this. You know, it's Chris.Kopp. You can read that at pptjax.com. You can IM me on Facebook. So I'm on Facebook with Premier Physical Therapy. I'm on Facebook as a person, I guess. And
we'll make sure to put your contact information
Sure.
in a comment on this video. Yeah. So after the video is all said and done, we'll put your contact information at the bottom there. So if you guys have any additional questions, feel free to reach out to Chris, local Jacksonville physical therapist, and happy to help you out with any questions that you have. Thank you so much for doing this, Chris. We really appreciate it.
Thanks a lot, Scott.